A 68-year-old man came into my office last spring, convinced he just wasn't drinking enough water. He'd been waking up every single morning with his mouth completely parched, lips cracked, tongue sticking to the roof of his mouth. His wife had bought him one of those giant water bottles from Walmart, and he was drinking almost 100 ounces a day. Nothing changed. 3 months later, we ran a full panel of labs. What we found had nothing to do with hydration. He had stage 2 chronic kidney disease and moderate sleep apnea, and dry mouth was the only symptom his body had been producing for months. I'm Dr. Kyle Hargrove, a family medicine physician based in Chicago, Illinois. I see patients over 60 every single week, and I'm telling you right now, waking up with a dry mouth every morning is not something you brush off or fix with a bigger glass of water at bedtime. That symptom is your body activating an alarm system. And in this video, I'm going to walk you through 9 conditions that can cause persistent dry mouth in adults over 60, including the one at the end that most people never even consider and that doctors often miss completely. Before we get started, please tell us in the comments your name and the city you are watching from. We would love to know. Dry mouth, the medical term is xerostomia, happens when the salivary glands don't produce enough saliva to keep the mouth moist. In adults over 60, this is far more common than most people realize. According to the CDC, nearly 30% of older adults report chronic dry mouth, but the majority of them never mention it to their doctor because they assume it's normal aging. It is not. Saliva does critical work in your body. It neutralizes acid, protects against bacteria and fungal infection, aids digestion, and signals the state of your nervous and endocrine systems. When it disappears overnight, every single morning, something upstream is going wrong. Sign number 9, your medication list is quietly destroying your saliva production. Most people over 60 are on at least one prescription medication. Many are on 5, 6, or more, what doctors call polypharmacy. What almost nobody tells you when you pick up that prescription at CVS Pharmacy is that over 400 commonly prescribed drugs list dry mouth as a side effect. And for older adults, the effect is dramatically more pronounced than it is in younger patients. The biggest offenders are ones you probably already take. Blood pressure medications, especially diuretics like hydrochlorothiazide and ACE inhibitors, reduce fluid throughout the body, including in your salivary glands. Antihistamines like diphenhydramine, found in Benadryl and most over-the-counter sleep aids, actively suppress saliva production. Antidepressants, particularly older tricyclics and SSRIs, are known culprits. Bladder control medications, anxiety medications, and even some cholesterol drugs can all reduce salivary flow significantly. Here's what makes this particularly dangerous in older adults. The dryness often develops gradually as medications build up in your system over months or years. You don't notice the slow change until one morning you wake up and realize your mouth feels like sandpaper every single day. By then, the saliva deficit is significant. And without adequate saliva, you become highly susceptible to oral infections, tooth decay, and, critically, difficulty swallowing, which in older adults dramatically increases the risk of aspiration pneumonia. Do not stop or change any medication on your own, but bring your full medication list to your next appointment and specifically ask whether dry mouth is a listed side effect. Often there are alternative medications, adjusted timing, or formulations that don't carry the same impact on your salivary glands. Sign number 8. Your blood sugar has been running high for longer than you think. Type 2 diabetes is the second most common chronic condition in American adults over 60, affecting more than 26% of seniors, according to the CDC. And one of its earliest and most persistent symptoms, one that gets ignored constantly, is dry mouth that's worse in the morning. Here's why this happens. When blood glucose levels are elevated, the kidneys go into overdrive trying to flush excess sugar out of your body through urine. This process pulls massive amounts of water from your tissues, and the salivary glands are not exempt. The result is a systemic dehydration that hits hardest overnight when you haven't had any fluids for 6 to 8 hours. You wake up parched, drink some orange juice, which ironically spikes your glucose further, and the cycle continues. What's insidious about this pattern is that many people with undiagnosed or poorly controlled type 2 diabetes feel reasonably fine during the day. They're eating breakfast, drinking coffee, moving around. The dry mouth seems like a morning issue, not a blood sugar issue. But the body is running on elevated glucose around the clock, and the morning symptom is simply when the depletion becomes impossible to ignore. A 2021 study published in the journal Diabetes Care found that patients with hemoglobin A1C levels above 7.5 were significantly more likely to report chronic xerostomia compared to those with well-controlled blood sugar. The connection is direct, measurable, and clinically confirmed. If you're waking up with dry mouth and you haven't had your A1C checked in the last 6 months, get it checked. It's a simple blood test and Medicare covers it. Sign number 7. Your kidneys may be struggling and sending you the only signal they can. Chronic kidney disease is called a silent killer for a reason. The kidneys don't have pain receptors. They don't give you a warning flare. By the time you feel sick, you may already be in stage 3 or beyond. But there are early signals, and dry mouth is one of them, particularly in the morning hours. When the kidneys lose filtering efficiency, waste products that should be excreted in urine begin to accumulate in the bloodstream. One of those byproducts is urea. As urea levels rise in the blood, it begins to affect saliva composition, reducing its production and altering its chemical makeup. Some patients also develop a subtle metallic or ammonia-like taste alongside the dryness, which is nearly always a kidney-related signal. Additionally, the kidneys play a central role in fluid regulation throughout the body. When they're not functioning properly, fluid balance becomes disrupted at a cellular level, and the mucous membranes of the mouth and throat are among the first places that disruption becomes noticeable. Risk factors that make this more likely in older American adults include a history of type 2 diabetes, long-term use of NSAIDs like ibuprofen or naproxen, both available over the counter at any Walmart or CVS, high blood pressure, and a family history of kidney disease. If you've been using painkillers regularly for joint pain, arthritis, or back issues, your kidneys may be absorbing the consequences silently. A basic metabolic panel, which checks creatinine and GFR, can detect early kidney damage before serious symptoms appear. Sign number 6. Your heart and blood pressure medications are working against your mouth at night. The American Heart Association estimates that nearly 70% of adults over 65 in the United States have some form of cardiovascular condition requiring medication. Hypertension, heart failure, arrhythmia. These conditions are managed daily with drugs that in many cases directly reduce the moisture available to your mouth while you sleep. Beta blockers, which are among the most commonly prescribed heart medications in the country, reduce both heart rate and the activity of the autonomic nervous system. That same nervous system controls saliva production. When beta blockers suppress autonomic activity, they suppress salivary output as well, often most noticeably at night, when the parasympathetic nervous system is meant to be active and maintaining baseline moisture. Diuretics, which are used to reduce fluid buildup in patients with heart failure or high blood pressure, work by pulling water out of the body through the kidneys. This is effective at reducing blood pressure and edema, but it comes at a cost. By morning, after 6 to 8 hours without fluids and with diuretics still active in your system, the mouth can be severely dried out. This doesn't mean you should stop your heart medication, not even close. But it does mean that if you're on cardiovascular medications and waking up dry every morning, the connection is likely direct. And there may be timing adjustments or supplemental strategies your cardiologist or primary care doctor can recommend. A 2019 study published in the Journal of the American Geriatric Society confirmed a statistically significant association between polypharmacy for cardiovascular conditions and chronic xerostomia in adults over 65. Sign number 5. You may have sleep apnea and not know it. This one surprises people every time. Most adults over 60 who have sleep apnea have never been diagnosed. The American Academy of Sleep Medicine estimates that up to 80% of moderate to severe sleep apnea cases in the United States remain undiagnosed. And one of the most consistent complaints among people with undiagnosed sleep apnea, particularly those who breathe through their mouth during episodes, is waking up with severe dry mouth. Here's what happens. When the airway partially or fully collapses during sleep, your body instinctively opens your mouth to compensate and pull in air. Mouth breathing bypasses the nose's natural humidification system and evaporates saliva at a rapid rate throughout the night. By morning, the tissues of the mouth and throat are significantly dried out. The dryness isn't a coincidence. It's a direct mechanical consequence of your airway failing repeatedly while you sleep. What makes sleep apnea particularly dangerous for adults over 60 is the cardiovascular strain it creates. Every apnea event drops oxygen levels in the blood and spikes cortisol and adrenaline, forcing the heart to work harder. Over time, untreated sleep apnea dramatically increases the risk of high blood pressure, atrial fibrillation, stroke, and heart failure. Have you ever woken up with a headache first thing in the morning, or felt exhausted even after what seemed like a full night of sleep? Those symptoms, combined with dry mouth, are the classic triad of undiagnosed sleep apnea. A sleep study, which can now often be done at home through your primary care doctor, can confirm it and open the door to treatment. If CPAP therapy is recommended and you're already using it, make sure your mask is fitted properly, because air leaks around the mask are a common cause of dry mouth, even in people already on treatment. Sign number 4. An autoimmune condition called Sjogren's syndrome may be attacking your glands directly. Most people have never heard of Sjogren's syndrome. That's part of the problem. It is one of the most common autoimmune diseases in the United States, affecting an estimated 4 million Americans, the vast majority of them women over 40. And its hallmark symptom, the one that defines it clinically, is severe and persistent dry mouth combined with dry eyes. In Sjogren's syndrome, the immune system mistakenly attacks the body's moisture-producing glands. The salivary glands and lacrimal glands, which produce tears, are the primary targets. Over time, this immune assault causes those glands to progressively lose function. The result is chronic, worsening dryness that no amount of water can fix. Because the problem isn't fluid intake, it's that the glands themselves are being destroyed from within. Many women in their 50s, 60s, and 70s dismiss dry mouth and dry eyes as part of aging or menopause. They go years, sometimes over a decade, without a diagnosis. In the meantime, the disease can silently affect other organs, including the kidneys, lungs, and nervous system. Sjogren's is also associated with a significantly elevated risk of developing non-Hodgkin's lymphoma, which is why an early diagnosis is medically critical, not just for comfort, but for survival. If your dry mouth is accompanied by gritty or burning eyes, difficulty swallowing dry foods like crackers or bread without a drink, or dental decay that seems disproportionate to your oral hygiene, Sjogren's should be on your doctor's radar. A rheumatologist can confirm the diagnosis through blood tests checking for specific antibodies, and in some cases, a minor salivary gland biopsy. If you haven't subscribed to this channel yet, please do it now. Every week I publish videos specifically for adults over 60 that cut through the noise and give you the information your body actually needs. Sign number 3. Your thyroid may be slowing everything down, including saliva. Hypothyroidism, an underactive thyroid, is significantly more common in adults over 60 than most people realize, particularly in women. The American Thyroid Association estimates that 1 in 8 women will develop a thyroid disorder during her lifetime, and the risk increases substantially after menopause. In older adults, hypothyroidism is also notoriously underdiagnosed because its symptoms, fatigue, weight gain, constipation, cognitive slowing, dry skin, are routinely dismissed as normal aging. Add dry mouth to that list. The thyroid gland produces hormones that regulate metabolic rate throughout the entire body, including the function of exocrine glands like the salivary glands. When thyroid hormone levels drop, salivary gland activity slows. The mouth becomes dry, particularly after the prolonged fast of overnight sleep when there's nothing stimulating saliva production mechanically. What makes hypothyroidism particularly tricky in older adults is that symptoms often develop so slowly and subtly that neither the patient nor the physician puts the picture together until a blood test is done. You might feel like you're just getting older, a little more tired, a little more forgetful, a little drier. But these are not inevitable features of aging. They are potential symptoms of a treatable endocrine disorder. A simple TSH blood test, thyroid stimulating hormone, can identify hypothyroidism in minutes. If your levels are out of range, treatment with a daily thyroid hormone replacement medication is generally straightforward, well tolerated, and in most cases dramatically improves quality of life. Medicare covers this test as part of routine blood work. If you haven't had your thyroid checked recently and you're experiencing persistent dry mouth along with unexplained fatigue or weight changes, ask specifically for a TSH level at your next visit. Sign number 2. Nerve damage from diabetes or other conditions may have silenced your salivary glands. This is a connection most people never make, and even many primary care doctors overlook it. Diabetic neuropathy, nerve damage caused by long-term elevated blood sugar, is commonly associated with numbness and tingling in the feet. What's far less discussed is that the same process can damage the autonomic nerves that control the salivary glands, causing them to progressively underperform even when blood sugar is brought back under control. The autonomic nervous system operates every process in your body that you don't consciously control. Your heart rate, your digestion, your breathing, and yes, your saliva production. In patients with long-standing type 2 diabetes, the small autonomic nerve fibers are particularly vulnerable to glucose-related damage. When those nerves are compromised, the signal to produce saliva becomes weak or intermittent. The salivary glands don't fail dramatically. They just quietly produce less and less, and the deficit is worst in the morning when no external stimulus is triggering them. This form of dry mouth is particularly resistant to standard remedies like mouth rinses or increased fluid intake, because the problem isn't systemic dehydration. It's a broken communication channel between the nervous system and the glands themselves. Recognizing this matters because it changes the treatment strategy entirely. Autonomic neuropathy affecting the salivary glands can also occur in patients without diabetes, particularly those with Parkinson's disease, certain autoimmune conditions, or a history of radiation therapy to the head or neck. A 2020 study in the Journal of Oral Pathology and Medicine found that patients with confirmed autonomic neuropathy had salivary flow rates significantly lower than healthy controls, regardless of hydration status. If you have diabetes, Parkinson's, or a history of head and neck radiation, and you wake up with severe dry mouth every morning, this mechanism is very likely a contributing factor, and there are targeted treatments your doctor can explore, including cholinergic medications that directly stimulate gland activity. Sign number 1. Your dry mouth every morning may be the earliest detectable warning sign of a neurological condition developing silently in your brain. This is the one that changes everything. And I need you to pay close attention here, because this is information that most people don't hear until it's too late to act on it. Parkinson's disease and certain other forms of neurodegeneration, including Lewy body dementia, one of the most common and most underdiagnosed forms of dementia in older adults, have a well-documented preclinical phase that can begin 10 to 20 years before the motor symptoms appear. During this phase, the disease is quietly damaging the autonomic nervous system, and because the salivary glands are controlled by autonomic nerve pathways, their function can begin to degrade during this premotor phase, often long before any tremor, rigidity, or memory problem becomes obvious. In people who later develop Parkinson's disease, researchers have identified a cluster of early autonomic symptoms that appear years before diagnosis. These include constipation, loss of the sense of smell, disrupted sleep with vivid dreams or physical movements during REM sleep, and, critically, chronic dry mouth. The dry mouth in early-stage neurodegeneration follows a specific pattern. It's worst in the morning, it doesn't improve meaningfully with increased fluid intake, and it often coexists with subtle changes in swallowing, particularly a slight difficulty managing thin liquids. A landmark study published in JAMA Neurology tracked over 800 adults and found that autonomic dysfunction, including significantly reduced salivary output, was measurable in individuals who later received a Parkinson's diagnosis, on average 7 years before their motor symptoms began. This is not a peripheral or speculative finding. It is one of the strongest early biomarkers of neurodegeneration identified in the literature. What does this mean for you practically? It means that if you are over 60, waking up with dry mouth every morning, and you also experience any combination of the following: chronic constipation, reduced sense of smell, vivid or disturbing dreams, small handwriting, soft or low voice, or a very slight shuffling in your step, you need to bring that complete picture to a neurologist, not just your primary care doctor. Do not present these symptoms one by one at different appointments, because individually they may be dismissed. Presented together, they form a clinical pattern that has specific diagnostic protocols. Alpha-synuclein, the protein that aggregates abnormally in Parkinson's disease, can now be detected in skin biopsies and cerebrospinal fluid before motor symptoms begin. The FDA has cleared diagnostic tests for this purpose. Early detection matters because neuroprotective research is accelerating, clinical trials are actively enrolling, and patients who are identified early have access to interventions and monitoring that can make a measurable difference in long-term outcomes. This is no longer a condition where you wait for the tremor. The window for action is now, and your dry mouth may be one of the few windows your body is actually giving you. And now, as I promised at the beginning, here is the specific, practical information you need to take with you today. There is a simple, inexpensive, at-home test that takes less than 5 minutes and can give you meaningful information about your salivary gland function before your next doctor's appointment. It's called the Saxon test. You place a dry gauze pad under your tongue for 2 minutes, then weigh it. Healthy salivary flow should produce at least 2 grams of saliva in that 2-minute window. Anything significantly below that is considered clinically reduced flow. This test is used in rheumatology offices to screen for Sjogren's syndrome, but it gives useful baseline data regardless of the suspected cause. Write down your result and bring it to your doctor along with a list of every medication you take, including over-the-counter drugs and supplements. That single piece of information, your salivary flow rate, combined with your symptom timeline and medication list, can dramatically accelerate the diagnostic process and get you to answers weeks or months faster. Every morning, you wake up with that dry, cracked, parched feeling in your mouth and chalk it up to age or poor sleep. You are missing a signal your body is spending real energy trying to send you. The body does not produce symptoms randomly. Dry mouth every single morning is a pattern, and patterns in medicine mean something. The question is whether you act on it now while the information is still useful, or later when it isn't.